afternoon and karibu sana to Midweek Vibes show today. As always, a joy to be coming live to you from Mamlaka Hilchapa Raka. And today we are excited to continue with exciting discussions, and we'll be exploring an interesting topic, emergency rescue services, specifically in Kenya. And I feel like this is a topic that hasn't been fully explored, or probably most of us are not aware on what this really means. And to help us explore that topic, we are joined by a guest. And our guest today, I'll turn to him and ask him to introduce himself, to tell us who he is and what he does. So karibu.
Thank you very much, Reverend Jasmine. My name is Dennis Mbogo. I work for AR Healthcare, Kenya Limited, in the Emergency Rescue Department. And our co-work is rescue and evacuation of victims and casualties.
Karibu sana, Dennis.
Asante sana.
It's a joy to have you today.
Thank you
and
very
on
much.
my left is my co-host, who I'll also ask to say hi to the people.
Thank you so much, Reverend Jasmine. My name is Charity Wamboi. I'm part of the pastoral team here at Mamlaka Hilchapa Raka. And it is a joy to be in today's show.
Karibu sana, Charity. Such a joy to do this with you. And our first question, Dennis, of course, goes to you. And it's probably to ask you to define emergency rescue services. We hear that. What's the scope of emergency rescue services?
Okay, emergency rescue services is a wide area in the emergency department, and also the way we work. It's usually divided into three.
Okay.
There is the ambulance, what we know the ambulance,
Yeah.
and the fire engines,
Okay.
and then there is police.
Oh,
That's what encompasses the whole emergency rescue services.
okay.
So if you have a medical or traumatic incidents,
Yes.
that's when you call the ambulance.
Okay.
So many people refer it to emergency rescue,
Yes.
but it usually encompasses the three aspects.
Yes.
So in the developed world, we have what we call the emergency medical services, where a person sits in a dispatch. If there's a call which comes through, they can be able to sift through if it's a security issue, or it's a medical issue, or it's a fire issue.
Yeah.
So that's what encompasses emergency medical services. We call it emergency medical services.
I see. Okay. All right. Maybe one more question is, as AAR, which one do you specifically deal with?
So for AAR Healthcare, first of all, the word AAR stands for African Air Rescue.
Air rescue.
Yes.
Okay.
It started as a air evacuation company
Yes.
back in 1984. So along the way, they bought ambulances, and then they diversified to healthcare, where we have the outpatient centers, the clinics,
Yes.
and then diversified further to AR insurance. So for me, I work in the AR Healthcare Kenya department, but the emergency rescue services.
Okay.
Yes.
Wow.
Thank you for that clarification. You mentioned that we can make a call
Yes.
to your organization. So we know there's a number that most of us know. We know 911.
Yes.
So what is the number we are supposed to call in case we are faced by an accident or an emergency of someone who's unconscious?
Okay, for here in Kenya, for the emergency medical services, it's usually not well structured. But for that reason, that's why we have private companies which offer the emergency medical services. Like for us, AR Healthcare, we are a private entity
Okay.
which we offer those services. You also know we have the county ambulances.
Yes.
Those are the government ones, which you can also call, but you have to get the numbers because they're usually situated in health centers. Okay. For us, for AR Healthcare, we have a number. We have two numbers for emergency. I don't know if you can dot it down.
Okay, sure.
It's very easy to remember. It's 0725 225 225.
This is very helpful. Okay.
The number is 0725 225 225.
Okay.
When you call that number, it's a 24-hour emergency line.
Is it toll free? is it charged when I call? Does it go? Will I be charged, or it will be free?
As you can notice, it's a Safaricom line,
Yes.
but it's hooked up on our office,
Okay.
where a person is there 24 hours to man it, to receive calls, any emergency calls.
All right.
Sorry,
So go
the
ahead.
reason I'm asking, a little bird somewhere
Yes.
told me there's a possibility that it's a free service to call an ambulance. So when I call an ambulance, will I be charged, or because it is just ferrying me from one place to another, it won't be charged? Because there's that notion it could be free. Yeah.
Yeah, that notion is there, especially in Nairobi,
Yes.
because people tend to think that ambulance service is free, but as I've pointed out, we have the private sector and the public sector.
Public sector.
Yes. For us at AR Healthcare, it's mainly for members who have subscribed
Okay.
to our insurance company and healthcare side. For the public ones, you can call 999. I think that one still works.
Okay.
If you call 999, it will go to the police service, and then you'll ask them for the ambulance.
Okay.
And then they will try to patch you to an ambulance service, which for this part, it will be the public ambulance.
All right. Okay. Good. I'm wondering, when we talk about emergencies, let's define what qualifies an emergency. When can I call for a rescue call? When can I call you guys? Do you deal with specifics? It's only when it's an accident. When can I call for ambulance services?
Okay. Let's start by defining what an emergency is.
Sure. Yeah.
Exactly.
Yeah.
An emergency can be any disaster or anything that happens, whether man-made or natural, isn't
yeah.
it? So it can be like you've fallen sick in the house, or you've witnessed an accident along the way while going to work. Okay. So what qualifies for you to call an ambulance? If it's a victim or a casualty who you think is in danger,
Okay.
or you are not sure if they are alive or not.
Okay.
Yeah.
Okay. So any situation that looks
Any
like
s-
that,
Any situation.
I'm allowed to go ahead and call.
You can be sitting with Charity here,
Yeah.
and then the next minute she faints. And then you are not sure of how to deal with it. Okay?
Yeah.
Maybe you are not a trained first aider, or you don't have the knowledge to help Charity.
Yes.
So
Yes.
the next instinct of a human being is to call for help,
Yeah.
isn't it?
Yeah.
Yes.
So if you have a number for an ambulance you call,
Yes.
then you'll know how to help Charity.
To help. I see. All right. That's really good to know. I'll share about a recent experience I had
Yes.
of a person who passed away at home, and I'm wondering, does that qualify for me to call AAR to come and offer, to give an ambulance so that the body can be transferred to the morgue, or does that disqualify me?
Okay. In the emergency medical service sector, if a person, like let's say they have passed on, maybe in the house, okay, to us, the first protocol is to call an ambulance or call an ambulance service
Yeah.
to get help first,
Okay.
so that we can ascertain if this person is alive or not. So I can imagine you call the police first. How will they ascertain that that person is alive or not? Okay. So the best bet is to call an ambulance. Since they are medics, they can ascertain or assess if that person is alive. You'll not want to find situation where you take the body to mortuary and then they wake up in the mortuary, isn't it? Yeah. So you call the ambulance. After calling the ambulance, if they ascertain that the person is not alive, the next step is to call the police. Okay. And something to note is, please, I think people don't know, if somebody has died in the house, you don't move that person out of that area, because naturally that area is a crime scene,
I see.
because they need to investigate and know what happened.
Yeah.
So if you call an ambulance, the ambulance team will ascertain, then they will tell you to go to the police to record what happened, and we'll give them the professional advice that we found this person and they are not alive due to this and this. And then they give you the OB number. And then after that, you call a hearse to carry the body.
Let me take you aback.
Yes.
You said AR is something air rescue.
African Air Rescue.
Rescue. That was the initial idea for the organization.
Yes.
So I wanted to ask, is it possible to use roundabouts as a possible place where, do you still use helicopters or choppers to offer air rescue in case there's a big guy, a rich guy who can afford the chopper? Is it lawful to use the roundabouts as a possible place to use the chopper?
I think we only see this in the movies, but not here in Kenya.
Okay.
The structure or the infrastructure cannot support the evacuation by helicopter. But we still do evacuations through the fixed wings. We call them the fixed wings, apart from the helicopter. We do evacuations from, let's say, remote areas like Masai Mara, if you have the capability of paying it. Okay. So for urban areas, it's very hard, like here in Kenya, to do such evacuations.
Okay. All right.
So it is only viable to members without extra charge?
For members, because you have that insurance card, it will cater for the evacuation.
For the evacuation, I see. All right. Okay, thank you for clarifying that. What we'll do, we'll take a few minutes break, and then when we come back, we want to, let me call it this way, demystify the ambulance on the road. I feel like it's always a very scary and at the same time curious thing, especially whether you're a passenger or a pedestrian or a driver. You want to know what is really going on and what is the proper conduct for me when I see an ambulance. You know, how do I know that the driver in the ambulance is doing the right thing? How do I know what I should do as a person who is watching an ambulance? Those are some of the things that we could probably explore some more, define some more, so that we are better people, you know, when we see or when we have an interaction with the ambulance.
It's very true.
See you shortly.
Ewe Mungu wa majeshi, ninapenda kukaa nawe, maskani zako zapendeza, nazikondea kwa shauku kubwa. Heri siku moja mbele zako kuliko siku elfu mbali na wewe. E Bwana, nguvu na msaada wangu, takupenda daima. Moyo na mwili wangu Bwana vyakulilia Mungu wangu, na heri nikose vyote Baba, lakini nikupate wewe. Heri siku moja mbele zako kuliko siku elfu mbali na wewe. E Bwana, nguvu na msaada wangu, takupenda siku moja mbele zako kuliko siku elfu mbali na wewe. Bwana, nguvu na msaada wangu, utakupenda daima.
Welcome back to Midweek Vibes. Today we were tackling the issue of emergency rescue. And we have been led pretty well by a professional here, Dr. Dennis. Thank you for doing that. But before we go on, there's a question. We'd like to know, what is the conduct of an ambulance on traffic? Say, for example, is it lawful to use the other side of the highway? And we are on this other side. And how can we certify that really there's an emergency inside the ambulance?
Thank you very much, Charity. I think there's a big myth surrounding an ambulance. Even the lay people
Yes.
usually ask, what do you do with an ambulance in traffic, and then suddenly you are putting siren? There's usually protocols to follow when you are driving an ambulance, or we usually say operating an ambulance.
Yeah, okay.
When you have an emergency, it doesn't necessarily mean that you have a patient or a casualty inside the ambulance for the lights and the siren to be on. Okay.
Okay.
It can be that you've been sent to pick or to rescue a patient
Sense, yeah.
at an accident scene or home or an office. It can be
Yeah.
anything. Okay. The other question is, you'll find an ambulance following traffic, and then all of a sudden, it turns
Siren
the
goes
siren
on.
and everything. It's because we usually, for an ambulance to operate, you usually have a dispatch center, which controls the ambulance.
Okay.
So maybe you are from a call in a hospital, and then you are going back
Yeah.
to base. And in the middle of traffic, you are raised, usually through the radio or the phone, to go and rescue somebody. That's when you put the siren on. Now, another thing is going wrong side.
That's always been a mystery.
Really of us.
When you are on siren, we usually call it code 3. Code 3 is
Code
usually
3,
the
okay.
the lights, the siren, the blinkers. Usually is the judgment of the operator. And then also you have to be sure that you are safe. When you are on siren and blinkers, you are allowed by the law to go the opposite side of the road.
Okay.
And I know many people tail ambulances on the wrong side also.
Yeah,
Yeah, it's
absolutely.
very dangerous.
Yeah.
It's
okay.
not supposed to be that way.
Yeah.
But when you don't have the siren and the blinkers, you're supposed to follow traffic. It becomes a normal car.
Okay.
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 That's what usually happens.
So that's the mystery on the road.
Yeah.
the mystery side.
So if you find that there's a siren and lights on, there are usually two scenarios. They are going to evacuate a patient or rescue a patient, or they have a patient inside.
Yeah. Yeah.
But is there communication? For example, if I'm a police on traffic
Yes.
and I am not so sure that you're on code 3, is there a way you communicate on radio to communicate to the police to tell them you're actually on code 3? That's why we are using the other side of the road.
Communicating with the police, because first of all, here in Kenya, we don't have those channels. Everybody has his channel. The
Okay.
police have their own channel, the ambulance has its own channel, and the fire department has its own channels. So the only way they can assist us is usually when they hear the siren
The
on the
siren.
road.
Okay.
That's it.
Yeah.
We have not reached that level of intercommunication. As I was saying, the police, the fire, and the ambulance.
To
We
work
have
in collaboration.
collaboration.
Yeah, interconnected.
Okay.
All right. Okay. Other curious one is when, let's say you're, for instance, somewhere, you're probably walking or you're this and that, and then an emergency happens on you, but there's an ambulance on the road.
Yes.
Do I have the right? Am I allowed to stop it to come to my rescue and help me with the emergency that I have? Without calling,
calling.
without what? I just saw an ambulance on the road without sirens on, maybe?
Thank you very much. That's a very valid question. You can be out there and then you witness an accident or, like you said, you found an ambulance coming and then there's an accident somewhere. You have a right to stop it. Under the law of Kenya, ambulances, while on the road, if you witness an accident, you are liable to help that casualty.
Okay.
An ambulance cannot pass.
Okay.
So if you stop it, it will stop and it will help the casualty.
Oh, they will
What
help
happens if they don't stop?
Now that's not a qualified or a professional
Not
ambulance
appropriate for-
operator.
Okay, I see.
Yeah.
And do you guys, let's say you have a case already, you have
Yes.
you have someone in the ambulance already that
Yes.
you're taking care
Yeah.
of, but then there's there's another emergency and I have stopped you. Do you guys stop, or if you already have someone, a victim inside the ambulance, do you just continue and leave me, or do you offer help of a number I can call or something? How do you handle? Can you have two people actually in one ambulance?
Okay. In a normal ambulance, you'll find only one stretcher, isn't
Okay,
it?
yeah. Yeah.
If I have a casualty or a patient inside the ambulance and I witness an accident, I'm supposed to stop
Oh, still.
and stabilize the patient,
Okay.
the casualty on the road. And then I'll call our dispatch to tell them they should look for options to send another ambulance.
Ambulance.
Yes, to
take
come.
care of
Yes,
that.
yes.
Okay, so I'm still allowed. That's really good
Yeah.
to know, because that scares us quite a bit on not knowing what's the right thing
Yes.
for me to go ahead and do. I think one of the things that has currently our government has really tried on is ensuring that NHIF cover is working. I'm
Yes.
wondering, does NHIF cover in ambulance services? Do you guys take that?
For us, okay, in the private sector,
Okay,
we
you're in the
don't.
private sector.
Yes,
You're in the
because
private
we are so many
sector.
of us,
Yeah.
the private ambulance services. Unfortunately, we don't take NHIF.
Okay.
Yeah. But
Do you know
if
about the public sector? Public
for NHIF, if you have the card, the protocol is you call their office so that they can organize for an ambulance. Yes.
You call the NHIF
NHIF,
office,
yes.
so that
They have emergency numbers.
Okay,
yes.
all right.
And then they'll organize. Usually, the Red Cross ambulance covers NHIF. Yes.
Okay.
Let me take us back a bit. You said that if someone doesn't stop, whoever is driving the ambulance doesn't stop in case of an emergency, then is it safe to assume that this driver has to be well trained? And should they be people who are actually able to do first aid response to anyone, or is it just any other driver? What is?
That's a good question. You see, for us who work in the ambulance, especially in the Nairobi area, most of the operators or ambulance crew are usually trained. So you will expect them to follow the guidelines. For the public sector, they are coming up. They are being trained so that we weed out people who are not qualified. So it will be very unfortunate for somebody to pass a casualty or a patient on the road and not offer help.
That's your duty.
What's the purpose of that ambulance?
If
Yeah.
it's not
It's to save a life.
Yes.
Save a life,
Exactly,
I see.
yeah.
Okay. All right. That's really good. I'm curious on from your experience,
Yes.
success story.
Yes.
Definitely.
Okay, yeah.
And I'm speaking as a person who's been, all my life, I'm really loving this discussion because a lot is being clarified and seeing there's so much help outside there that I can utilize that I haven't utilized before. Any success stories that you can share with us from your experience, from you offering these services as AAR maybe? Yeah.
There are so many of them. You can imagine an ambulance on the road. You get to meet so many things and so many scenarios. I remember once I was on the road and then just going back after a call. And then out of the blue, so many people came on the road to stop me. So I stopped and I asked them what was wrong. They directed me to where a casualty was. Unfortunately, it was a mother who was nearly giving birth.
Okay.
I can say that. So we helped the mother. We put her in the ambulance, and then we have evacuated her to the nearest facility. I don't know if I can say it was unfortunate or a good deed. The mother gave birth in the ambulance. Then the baby came out well. And then it was a bouncing baby boy.
Wow.
And they both survived.
Yeah, wow, that's
Yeah.
beautiful because you were present. You guys were able to help
Yes,
with
yes.
that. That's amazing. I'm wondering, you know, when you're deeply invested in something, you realize about gems that are inside what I do,
Yes.
but are not quite known to the public.
Yes, yes.
And have you had those instances that you are like, Kenyans should know this, Kenyans should utilize this, Kenyans should be aware about this? Probably you could share with us if you have any that you can think of.
I think even this forum is a good forum because the word is getting out to so many people, even in this setting, and also where we are at AR Healthcare. Personally, I'm also a trainer in basic first aid and occupational health.
Yeah.
Okay, so we do so many trainings. We go to seminars, companies invite us, and then even in places where maybe there are events, we are usually called so that we can tell the masses on safety. Us in the ambulance or the rescue services, we usually advocate for safety. Okay, so we tell Kenyans, try to do the basic safety things, like you can do a course in first aid so that you can know when and how to help. And I can imagine in an accident scene, how do Kenyans react when they help a person? So you see, they can carry a casualty out of a car in a bad way, and then the person ends up in hospital and they are paralyzed.
Yeah.
So those things that we do, we usually also tell them. So how to handle an emergency, okay, and how to handle a casualty, let's say in an accident scene. So there are many forums which we usually do in events. But the good thing is these days, even in events, event organizers usually call an ambulance to be on standby. And then we can give a talk, and then that's how we get to the masses.
Okay.
Yeah.
Wow, that's really nice.
Just allow me to mention some of the people who have joined us. They are really appreciating the session. We have Paul Nduati. He's saying it's a very educative session. We have Agnes Shiaunda. I almost said it the wrong way. Such an informative session. Felix Otieno, Susan Kinyanjui, Millicent Mulengeka, and Caroline Murioki. It is a joy to have you, yes, for joining us in this educative session. Over to you.
Dennis, a random one. Why do you do what you do?
Pardon?
Why do you do what you do? How did you get there?
I don't know. I can say it's a calling. If you want to do something and then you're not scared of it, it's a calling. You have to do it.
Okay.
Yeah.
Okay. All right. Nice. What are some of the other ways that you utilize, that you guys are using to reach out to the community and to offer these services that you offer?
Okay. We even in our company at AR Healthcare, we have those free medical camps we can do.
Okay.
We usually do.
Okay.
That's one way of getting to the masses. Also, events like I was saying. Events you have to get to meet so many people.
Okay.
Yeah, I think those are the two major ways
the
of
major ways
reaching
that you reach
the
out
masses.
to.
Yes.
All right. Because of what I kept saying about ambulances and all that, and how scary, how personally I'm not aware or there's a lack of knowledge about them.
Yes.
I'm wondering, how do you help a person? I make a call, but then there's in need of your services, but then there's like a whole protocol that I probably should expect questions. Where are you? Yet, at that point, all I want, I have a casualty. You know, how fast you get here is dependent on whether they'll leave or not. How easy is your process for us to reach you? The other one is the number you gave us. Most of the times when it comes to service providers, you know, they take so long, you know, before you access them. Have you guys as AAR made the process of reaching you simpler? What is the protocol for us to easily get you so that you may offer this service to us? If you can define that a little more, to appreciate.
Okay, I'll start with what you had said. When you call for an ambulance, you want it to come there and then. Okay, those protocols must be there because we have to question what you want or how we can best help you. Because the capacity of the ratio of people to the ambulance, the people are many and the ambulances are few. You can imagine. So when you call our dispatch center, what the dispatcher will do will guide you on how to stabilize the patient.
Yeah.
And meanwhile, they are seeking help with the nearest ambulance.
Yes.
Okay.
Yeah.
So they'll calm you down
Okay.
and take you through on what to do
Okay.
to the casualty.
To the casualty before you
Before,
guys arrive.
yeah.
I think that's very helpful.
Yeah.
So there's something that I can do as I wait.
Yes,
I
yes.
wait you guys
Yeah.
to get to where
And that one is free of charge.
Oh,
When you
beautiful.
call,
Yeah.
they'll guide you.
Okay, okay, the guidance on what to
Yeah,
do.
it'll
Wow,
be there,
that's
yeah.
important. That's really good to know. I'm wondering, could you probably, the other thing that comes close to when I think about emergency services is, can you clarify the difference between ambulance services and hearse services?
Okay.
Is there a difference or are you guys one?
It's different
Okay.
because for ambulances, we use it for people who are alive. Okay.
Yes, okay.
If somebody dies or passes on in the house, the ambulances are not supposed to carry bodies.
So by law, you're not,
You are not
allowed to
allowed,
carry
yes,
a corpse?
yeah.
Okay,
So for that one, we leave it to the hearse
I
because
see.
they are the professional in handling
yeah.
bodies.
Bodies.
But there are those unfortunate incidences when casualties pass on
Pass
in the
on
ambulance.
way.
That's a different ball game
Yes.
because now we have to follow the protocols inside our ambulance. But in the house and somebody passes on, we usually call the hearse.
Okay.
Yes,
Wow,
yes.
that's
But we'll be there to assist you to go through the protocols and also to talk to you on even after the death so that we can be able to help you in handling the death.
okay.
Yeah.
All right.
So does that mean you possibly have some training on handling grief just immediately, that you're able to calm down someone? Is it psychology?
Or what kind of services?
What
do you have at
what
that point?
services that do
You
offer?
see, I think it kicks in.
Okay.
Okay.
Because
naturally.
you see, we have met so many of those incidences.
Yes.
And also we do what we call post-traumatic stress debriefing.
Okay.
So that we
Okay.
meet with professionals
Yeah.
to debrief us and then we talk. We also get the professional advice.
Okay.
We can transfer it to the relatives also.
Yeah, thank you.
Yes.
Wow, thank you. Thank you so much, Dennis, for sharing with us. I'm wondering, is there any parting shot that you could share with us?
Okay.
At the end?
Thank you very much, Jasmine, Reverend. This is just to tell people out there that at AR Healthcare, Kenya Limited, especially in the rescue department, we are there for you. And the ambulance services, you can call the number that we've given. You'll be given the advice, and possibly you can be given an ambulance if you need it. And then other services that we do trainings
Okay.
for first aid, also for nannies. We can do training for nannies.
Okay.
We usually do the training also in Kiswahili,
Nice.
so that they can be able to know
Yeah.
the protocols, and then first aid for individuals,
Yeah.
and then occupational health for organizations like Mamlaka Chapel
Okay.
can do for you.
Yeah.
And then for the community living around Ruaka, we have the outpatient center at Landmark Plaza, first floor.
Okay.
You can feel free. You can go there and seek also advice, and then you'll be helped.
All right. Thank you so much, Dennis,
You're
for
welcome.
making time and sharing your wealth of knowledge with us. This is
Thank you very
definitely an
much.
important part, and knowing that there are such resources available and
Yes.
how easily we can reach them. God bless for making time. And
Welcome.
asanteni sana for joining us live. I hope the discussion has been edifying for you. And until next week, stay safe and God bless.